But what I just wanted to sort of talk through to you really about sort of some of the hesitancy while we have got the colleagues on here, and why potentially some of the staff aren't vaccinated at this moment in time, and answer any questions in the first instance that you've got. Ben, do you want to give us an update as to where we're actually at in terms of vaccination levels in the community?
Yeah, of course, not a problem. So in terms of home care on the capacity tracker, which includes extra care, as of today, as I did the reports today, we're at 81 and 75%. So that's 81% for the first dose and then 75% for fully vaccinated. We're also at 25% for the booster as well. So that's not actually a bad uptake, considering, again, it's not currently mandatory. So it's a really good starting point, especially as Louise said, it's much higher than what we were for care homes when we started and were in this position last year. In terms of supported living, it's not too dissimilar. So we've got 85% on their first, we've got 76% on their second, or as would currently be counted as fully vaccinated, but we are at only 17% for their booster. But I do know from monitoring this on a weekly basis that supported living have had quite a spike recently in terms of vaccinations, so that's probably why there are not as many boosted as there is in home care and extra care.
Yeah, brilliant. Thanks, Ben. And just to say that one thing that we certainly found within care homes that work successfully is where it is about those supportive conversations. It is about just making them aware of how they can access it, how easy they can access it, and you supporting them to do so. And where, for instance, providers and managers have actually booked clinics for people to attend, the appointments for them to attend, and potentially supported them to go down there. We've even been down and held hands while they're having their vaccination because they've been concerned. And that is sort of been the most successful, is actually where you take charge with their consent, obviously, and managing that on their behalf and supporting them through the process. However, we do know that probably that remaining 20% and sort of 25% who've certainly not had their first vaccine, the second vaccine as well, they are probably hesitant, or there might be a number of reasons, or they may believe they're exempt. Now, with care homes, there is still currently a self-exemption available up until the 1st of April if they submitted that prior to Christmas Eve. But that will expire, and I don't believe there'll be any form of self-exemption available within this sector, because there is now a formal exemption pathway, which is via 119, and you go through the various questions there. They send a form out to the individual, they complete that, and then that is sent back and assessed by a clinician, and then a decision is made of whether someone is exempt or not. The difference that we have in Bradford is we were really lucky to be able to set up the Airedale pathway for exemption. So what we're able to do is, via the Airedale Hospital, is to route anybody who believes they're exempt or are very concerned about having the vaccine for a medical reason through to Airedale, and they can have a one-to-one sort of conversation to discuss what their hesitancies might be, what concerns they have, and how they can be supported to have the vaccine. Or obviously, if they are exempt, then they can be supported through that process with the clinical support. So Gavin, I don't know if you want to come in and just share a little bit about how that's worked so far.
Yeah, no, thanks for that, Louise. Yeah, so we found that the pathway that we had for the care homes was really, really helpful. We had lots of people coming through to us asking all range of questions and various myths that were out there. So one of the main concerns that we've got were people were worried about being vaccinated by airline staff, so staff that their perception was that they hadn't been trained as healthcare workers. So what we managed to do for them was we had to direct them to various clinics around the patch, one of which is Airedale, because we've only got healthcare workers purely working with our system. So that was one of the things. So we got some really good information as to why people weren't necessarily coming forward, which we've then addressed through some of the comms. With regards to medical exemptions, we now have really clear guidance that's been issued to all trusts back in October. When we're doing it through the care workers pathway initially, it was very much based on our clinical judgment at the time, and the advice we end up getting, end up being a day before the final deadline. But we've got really clear guidance for NHS trusts, which basically says that if you're receiving end-of-life care, then you're exempt. Depending on if you've got some severe learning disabilities or autistic nature, then potentially you may be exempt. Apart from that, there are no real other medical exemptions. There are temporary exemption if you're pregnancy, and if you've had one vaccine and you've had a severe reaction to that. But apart from that, there's no other real medical exemptions that are available. So I just want to make that clear so people don't go away going, oh, I've got a minor allergy to something. That's not the case. There are pathways there. If people have got allergies, we can refer through either coming to speak to someone at Airedale, we'll refer you through to the immunologists at Leeds. So there are pathways for that, but there's not really many medical exemptions that are available. I appreciate that if you're looking at the news and seeing what Novak Djokovic is going on there, and that'd be really interesting to see. But with regards to the UK, we have got some real clear guidance on that. Happy to answer any questions or any further information on that. Thanks, Louise.
Thanks, Gavin.